So colon cancer is the second biggest cancer killer. It follows lung cancer as having the most causes of deaths from a cancer. And it's also the third most common cancer in both men and women, prostate being the most common cancer in men, and breast cancer as the most common in female, then followed by lung cancer and then colorectal cancer. So colon cancer does start out as a benign polyp or a growth. It's found on the lining of the colon or the rectum. Most polyps often produce no symptoms. A polyp is essentially a precancerous lesion that can then progress to colon cancer. If these polyps are detected and removed before this progression, that's how colon cancer can be prevented. And obviously that's where screening becomes and plays a huge role. The American Cancer Society and the American Society of Colorectal Surgery recommends that those with average risk and no family history to begin screening at age 45. And this is a recent change. That age used to be 50, but with colon cancer affecting the younger population, the recommendation was changed in 2018 to age 45. Why, one can ask? Because 1 in 10 colon cancer patients are diagnosed before age 50. And depending on what is found during a colonoscopy, will then determine when that next colonoscopy might be required. If someone does have a family history of polyps or colorectal cancer, that means that screening should be started 10 years before a loved one was diagnosed or a polyp was found. In terms of how to find these polyps, colonoscopy is the gold standard for colorectal cancer screening. During a colonoscopy, we use a long, flexible instrument. It gets inserted and we evaluate the lining of the colon and the rectum. If there's an abnormality, it can be biopsied or removed and then sent to the lab for further testing. There are also multiple stool-based tests that can also look for signs of cancer in a person's stool. There is the fecal occult blood test, and that checks a stool sample for invisible amounts of blood from a colorectal polyp or a cancer, and this can be done yearly. And there's also a relatively newer exam called the Cologuard, which is a less invasive home test, and that looks at the presence of DNA in a stool sample, and that can be offered every 3 years. Of course, any of these, any positive results from these like non-colonoscopy screening tests then needs to be followed up with the colonoscopy in order to complete the screening process. There are multiple risk factors, and these are obviously multifactorial. Age is the biggest risk factor. The risk of polyps increases as we age, specifically over the age of 45. Family history, as we talked about, definitely increases one's risk. A family history of inflammatory bowel disease, meaning Crohn's disease or ulcerative colitis, or ovarian, endometrial, or breast cancer can also increase one's risk. Obesity, and having a diet that is high in fat and low in fiber. So back to the original question, in order to prevent colorectal cancer, one has to follow a low-fat diet, a diet high in fiber, meaning lots of fruits and vegetables, and regular exercise.